should be taking them. It's over a third of all English adults aged 30 to 84, and they are the best way to lower your risk of cardiovascular disease. Or are they? Joining me now, London-based consultant cardiologist, Dr. Aseem Malhotra. Good afternoon to you, Doctor. Great to speak to you again.
Hi, pleasure to be on.
You've seen the headline. Are you responsible in any way, shape or form for it, first of all? Do you have a vested interest in this story?
No, not at all. In fact, I've probably been one of the biggest critics of the lack of transparency when it comes to prescribing medications and statins in particular, Eddie. And, I'm a cardiologist that's treated thousands of people in my career with heart disease. I examined the evidence very carefully. And, I must confess I have no conflict of interest. The only interest I have is to look after my patient and try and give them the best quality of life that I can provide. And the reality is, when it comes to statins, I think the bit that's being missed, the nuance is it right for you? And are we allowing patients to make informed decisions based upon all the information that we're giving them? And sadly, for several decades, with the whole sort of campaign to lower cholesterol, we haven't been doing that. I mean, people have, this has been a drug that's been marketed as, being a miracle cure or for heart disease. And, it's a multi-billion-dollar industry has gone into it over the years. But the truth is, Eddie, when you look at the actual data, and unfortunately, most of this data, all of these sort of trials on statins, these clinical trials that show the benefits, are all from the drug companies. And obviously they have a vested interest. But even when you look at that data, the benefits of statins are much, much less than people realize. So just to give you an example, if you've had a heart attack or established heart disease, that's where there seems to be some clear benefit in terms of delaying death or prolonging your life. For an individual who suffered a heart attack, taking a statin every day for 5 years, there's a 1 in 83 chance that taking that statin will delay will prolong your life, and about a 1 in 40 chance it'll prevent a heart attack. There's another way of looking at the stats, though, which is very interesting, and I published a paper recently in the Pharmaceutical Journal with a couple of international reputed doctors on this topic. And one of the bits of research that was published looked at how much longer will you live if you take a statin, because patients often don't ask those questions. Some do, but they just presume it's some sort of life-saving drug and it's going to add years to your life. But actually, on average, if you've had heart disease, then taking a statin every day for 5 years, presuming you don't get side effects, you're able to take the statin for 5 years. The average increase in life expectancy for 5 years is very underwhelming. It's 4 days. 4 days. Now, patients are not told this, and the problem is, when you're taking these pills under the belief that it's giving you sort of, in many ways, the illusion of protection for many people, and then you're adopting an unhealthy lifestyle, then you can understand when you're talking about this affecting millions of people across the population, you've got a public health crisis. And one of the, root causes behind this public health crisis and the healthcare crisis we have, Eddie, is an over-medicated population, millions taking statins unnecessarily without even knowing.
Hold on, because and yet. Let me put that on to what you're saying. And yet, this is Professor Mark Baker, Director of the Centre for Guidelines for NICE. Here's what the professor says, and I'd like you to tell me why this doesn't make sense.
Sure.
Heart disease and stroke are largely age-related, killing 1 in 3 of us and disabling many more. To make progress in the battle against heart disease and stroke, we must encourage exercise, improve our diet, still further, stop smoking, and where appropriate offers can be made, offer statins to people who are at risk. So statins don't come in till the end. He's looked at the exercise, he's looked at the diet. It seems perfectly reasonable to me.
Eddie, I think Mark Baker's comments are absolutely very reasonable, but there's been a shift in NICE over the last few years because of this campaign for openness and transparency. If you go back a few years, Professor Baker was putting statins probably much higher up the list in terms of priorities. So absolutely yes. But again, even when you're prescribing pills, you need to be open and transparent with the patient. Anything less than that is unethical, in my view.
Right, but even here and now, if my mum is listening to this, if somebody is listening to this, how can they be better informed when they go in to see their GP and their GP may make a recommendation? How can you be informed enough to say, I think this is right for me, I don't think it's right for me, based upon what?
Well, actually, ultimately, it needs the doctors. They need to give that information to the patient so they can make informed decisions. Unfortunately, Eddie, and this is something that I've written about, other doctors have talked about as well, is that we have an epidemic of misinformed doctors, and therefore you then get misled and misinformed patients. And it's a problem. It's an epidemic. And part of that is a cultural problem. Part of it is that we have been misled, if you like, by pharmaceutical industry interests. Unwittingly, many doctors have not been practicing medicine in the way that it should be practiced with complete openness. And that's because we are reliant on information that comes to us from, drug industry and medical journals.
And I've got to stop you again. What is advice? Because that's what I want. I want to go forward and I want our listeners to live forever and all of that. Okay. What advice do you, Doctor, give to anybody listening to this who may well fall into that kind of 10% risk of developing cardiovascular disease?
Eddie, very important point. If you're coming to see me, so let's forget about the established heart disease patients where we know there is some benefit. If you haven't got established heart disease and you're in that kind of risk profile, the reality is the independent evidence says taking statin is not going to prolong your life by one day. That's the first thing. Now, what is going to give you the best quality of life and improve your longevity? There are a number of very simple things that we've kind of neglected, partly because there's no market for this message. It's very simple things. Healthy diet, which means cutting out all the junk food, the sugar, refined carbs, that kind of thing. Walking every day, just 30 minutes of walking every day, very powerful intervention for your health. Making sure you're thinking about your stress levels. Are you getting 7 hours sleep a night? Are you engaging in good social interaction? Are you spending more time with friends rather than on social media? These things together, combined, actually will combat, most of the heart disease epidemic for sure. And we've actually forgotten that. I actually went and researched and published a book called the Pioppi diet based upon this village in southern Italy where people live very healthy to an old age and not on lots of pills. They live average age of life expectancy is 89 for men and women. A lot of people live over the age of 100. They're not taking medications and they're still very agile and mentally alert into old age. We can all achieve that, but we need to think a little bit more carefully around the lifestyle. It's certainly not going to happen from all pill popping because pills like this, of course they have a benefit in some people, but in general, they're not going to improve your quality of life. If you're going to get side effects, obviously it's going to only decrease it. The thing about lifestyle changes, and you can do both, of course, the lifestyle changes are going to come without side effects. You're going to be healthier and happier in a short space of time. And that's what we need to shift the focus towards. And in general, across the population, Eddie, as well, I think what we need now, the future of healthcare, that's going to improve our healthcare system and even the economy, because if you've got sick people, you're not going to have a productive, working population, is going to be less drugs and more lifestyle.
Thanks very much. Dr. Asim Malhotra, the London-based consultant cardiologist, giving us his rundown. You may be on statins. You may have gone to your doctor and the doctor tried to prescribe them, or maybe you went in and asked for them. The headline, which might be a bit misleading, but it is, the headline and the Times are all the same. Give statins to almost all men over 60, GPs are told. I'd love to know what your thoughts are. Maybe you're more confused now that you've heard that than you were before, but maybe you've had problems and it has worked for you. Pick up the phone and give us a call. The number 020722422000. You can of course text 81333 and start your message with the word London. So if you